So welcome to our the next installment in our YouTube series on behavioral scientists talking about healthcare. The topic for today is what are some behavioral interventions or ideas to overcome the barriers to preventative health. So in our previous video, we talked about what are the barriers to preventative health. And just to recap, when we say preventative health, we mean all the things that you could be doing to improve or maintain your current state of health.
All the things you could be doing that you're not.
You're not, like exercising, cutting out junk food, quitting smoking. I don't smoke. Quitting smoking, drinking. I do drink. Or if you have meds that you take daily, then you should be taking those. So ideas. What are your ideas?
One idea that I had, and I think this is sort of something that seems very, I don't know, intuitive, but it's not always something that people do in practice, is making the behavior that you want to do very obvious. So having it immediately in your environment, having that cue to sort of trigger the behavior that you want to do. So for example, like if you want to work out, putting your clothes on the floor beside your bed in the morning so that the clothes are right there, and sort of changing that choice architecture of your environment so that it reduces the friction to achieving that behavior. Another example would be like putting your medication out on the table next to where you eat breakfast, for example. So having that be extremely obvious can help facilitate habit formation, because that initially cue triggers the behavior, and so that can actually help to reduce the friction of forming that habit.
I like those environmental interventions, but it strikes me it wouldn't work if you deep down don't want to do the thing. And if I imagine something easy like taking pills, a trigger might really do it, or if you're totally motivated to exercise. But I find motivation to me is the one that keeps coming back, especially for the costly things like exercising or quitting smoking or cutting out junk food. And it seems to me that it I've been thinking a lot about this transactional nature. You're doing it for something else, not because you want to do the thing. And in to go along with your idea, Leigh, I think if you can build intrinsic motivation for the thing you're doing, if you can try to enjoy your exercise or try to enjoy healthy food or try to enjoy not drinking or whatever, then you'll do it for its own sake instead of saying, okay, how do I force myself to do this? And then the triggers would become even more powerful.
Yeah, and I think that's really interesting because it's almost like intrinsic motivation. I imagine it's more rewarding just in and of itself to do the behavior, whereas in the beginning you need to make it even more rewarding to facilitate you doing the behavior. So one thing that I thought of is this idea of temptation bundling. So whatever, basically you want to increase the amount of enjoyment so that it outweighs the pain of execution. So for example, if you want to work out, allow yourself to watch Netflix like while you work out. Or if you're going to take your medication, then you give yourself your favorite ice cream. And so that can kind of counteract that pain of doing the thing that you don't want to do.
Yeah. I wonder if there's an element of making your commitment public. So, speaking for myself, which I don't exercise, but I imagine that if I were to try, and I've heard this with, there's studies to show this too, that if you make a social commitment, say, I tell Eric every morning that, okay, today I'm going to run 30 minutes and I intend to do so, I'm more likely to follow through with it because I've told Eric and I know that I don't want to go to him the next day and say, yeah, I didn't do it. And then maybe there's like an element of if you could ramp that up even more, maybe, depending on where everybody lives, if you're not in lockdown, then maybe you could have an exercise buddy or a healthy eating buddy, or if you are able to pair up with another patient who's got a similar condition to yours, how on track were you this week with taking your meds or exercising and whatnot? And I wonder if there's an element of social commitment too.
It sounds almost like you're that commitment connects it to shame, right? Which is, if you feel ashamed because you didn't follow through on your commitment, now you've got a present pain counteracting, the cost, instead of that hazy future pain that we talked about possible health outcomes if you don't do your preventative health care.
Yeah.
Social element can be a reward too, because I feel like some people want to, for example, work out with friends because that's rewarding. So it's like their time to kind of chat with their friends. Like I know for myself, when I started running, that was the only reason I liked running, was because I would just chat with my friends. And I was, this is fun. And I also loved swimming for the same reason, because I would like kick with my flutterboard and chat with my friend while I'm kicking with my flutterboard, right? But I didn't want to do it if my friends weren't there. So I think it can be rewarding just to have those people like and see them and do something fun together.
Mm-hmm.
Yeah.
I was thinking about the rewards of things, some of the health trackers, and, we used to have a Wii system and all that stuff, and you get these little rewards. It's like, you did 1,000 steps, you get a little star, and that can be motivating for a while. But I was thinking about that probably wears off or reduces your intrinsic motivation, but something a little bit deeper, like talking with friends or enjoying, the air as you exercise, or something else can be a more sustainable reward system, I think.
Yeah, and that's a thing, right? Getting especially like digital rewards or little badges, or there's like an app to track your progress. I think one of the challenges with that as a potential intervention, and it has worked, but I think the challenge going forward is that many of us are so uh, just inundated and overwhelmed by the number of apps available and the things that create notifications on your phone. And, speaking just for myself, I've started deleting apps and just having sort of like a minimalist system in my phone and not having a lot of those elements in there, getting rid of the things that give me badges. I just couldn't keep track of all the different
Feel more
things.
stressful.
Yeah, and it starts to feel stressful, exactly. And at some point you habituate to all of it too,
Mm-hmm.
where you start ignoring it basically. And I think that's one of the issues with these sort of digital badges. So yeah, I do love the idea of you know temptation bundling, just tangible, real things that you can bundle together to make your experience more fun.
I
Yeah.
see if it's part of nature too. Like if you have to walk to go to the store, it becomes just part of what you accept. Or if your work has physical components to it. Or I know we're focusing so much on exercise, but as much as these things can get built into your daily routine, as Leigh was talking about with cues, and they become necessary, and you don't think about them anymore as a challenge to your willpower.
Yeah,
Yeah.
that's a good point too. And it's also so dependent on your environment. Like I know when I went to Europe, and everyone there just had a different lifestyle of walking everywhere, and they would eat in these big social groups, but everyone would eat like really small portions. And then you're just like, my lifestyle started to change over the course of being there for those 2 weeks. So it's so funny because it's almost like, is it really your choice, or is it the environment that you're in, or is it both? It's probably a bit of both, but like your environment shapes you a lot too.
Well, I wonder how many people, to look at a different behavior, quit smoking simply because it became such a pain to have to find the smoking area or go outside of restaurants or whatever. A big environmental intervention there.
Yeah. Yeah. I know of a like there are a lot of quit smoking apps, and some of the more successful ones, paired with big environmental changes. There's going back to the element of motivation. There some of these apps I've seen, my friends have shown me, they if you care at the outset, they'll give you a survey like, what do you care, why do you want to quit smoking? And if I say, and so for many of my friends, they'll say, oh, it's actually because I'm spending too much money on smoking. It's dipping into my budget. It's taking away from my ability to pay for daycare, etc. And so the app will then show you how much money you save each week, um, while you reduce your smoking, and so you can see dollar amounts increasing. Like, this is how much money you've saved in the last 3 months because you've gone from 1 pack a day to just one cigarette a day.
That's cool. The app kind of converts something you're not intrinsically motivated for into something you are, right? Saving money. I wonder what else you can convert it into. Like, I've often worked with people who say, well, I'm quitting smoking, or I'm doing my whatever to be around for my grandkids. It would be cool if people weren't motivated by money saving, you could convert it into, average hours of life extended, or
Yeah.
Yeah.
Ties into their reasons.
And that seems more tangible than just a digital badge or like some kind of, closed loop circle that you get on an app. It's like a real life reward, like saving money. So I think there's something to be said for that too. It's more tangible.
Yeah. Well, we should wrap up. So thank you so much, Erick and Leigh, for sharing your thoughts. And we'll see you all at our next topic.
Wonderful. Thank you.
Thank you.
Thank you.